Welcome, everyone. Maddie's insights are practical tips based on current research to help pets and people and that you can use in your day-to-day work. I'm Dr. Sheila Segerson, the Director of Shelter Solutions at Maddie's Fund. Today, we're learning about the Animal Welfare Assessment Grid, a cloud-based tool that evaluates physical, behavioral, environmental, and procedural factors related to an individual animal and helps users take action to improve quality of life. Our two speakers today have logged in all the way from the UK. Dr. Sarah Wolfensohn holds the prestigious OBE, which for us US people is the Order of the British Empire for services to animal welfare, and is also a European veterinary specialist in animal welfare ethics and law, a subspecialty of the European College of Animal Welfare and Behavioral Medicine. Dr. Wolfensohn started her career in private practice and then spent approximately 30 years as a leader and professor at the University of Oxford and then the University of Surrey. Currently, Dr. Wolfensohn is an emerita professor and independent consultant and the director of Welfare Assessment Technologies, the company that created the Animal Welfare Assessment Grid tool. Dr. Rachel Malkani is the Group Clinical Research Lead for Independent Vet Care Evidencia, a global leader in veterinary care that is focused on animal well-being. She's also a researcher at Welfare Assessment Technologies. Dr. Malkani holds a PhD in veterinary medicine and veterinary science from the University of Surrey, and also a master's degree in animal welfare science, ethics, and law from the University of Glasgow. She's a veterinary and animal welfare scientist, as well as a clinical animal behaviorist. Thank you both for being here today and sharing information about the Animal Welfare Assessment Grid. Welcome, Dr. Wolfensohn and Malkani. Glad to have you here.
So I'm going to talk to you about the Animal Welfare Assessment Grid. And there's a little summary there of what I'm going to talk about how it can turn everyday animal care records into visual evidence of welfare over the animal's entire life, not single moments in time. And it scores various factors, which I'll talk to you about in a moment, revealing trends, pinpointing key events, and helping you take targeted action to improve the animal's quality of life. Whether you're caring for animals, conducting research, or making the case for change, the AWAG's data-driven insights will make animal well-being measurable, actionable, and easy to communicate. So let's think first of all about welfare. What is welfare? Well, of course, it's defined according to Mellor's 5 domains: nutrition, environment, health, behavior, and mental state, or the 5 needs, or the 5 freedoms. There's other ways of looking at it, but the up-to-date way is the 5 domains. And the Animal Welfare Assessment Grid parameters look at physical, which reflects nutrition and health, psychological, reflecting behaviour and mental state, the environment is there, and also procedural events, which impact on all of these 5 domains, whether they're veterinary procedure, management procedure, procedures that are good for the animal, procedures that are what you're doing because you're using this animal, transport, all these things will impact on its welfare. But it also looks at duration. So often people look at an animal's welfare at single moments in time. We'll look at it today. Oh yeah, come back in a few weeks' time. We'll look at it next year. Farm animals, for example, you go and inspect a farm once every couple of years. So this is to make sure we do it through the duration of its life, because we want to look at quality of life. The AWAG development, it was developed when I was working at the University of Surrey and also doing some work for Public Health England. When the COVID problem came, we were using primates to develop COVID vaccine. We used them first of all for TB vaccine, then we were using them for COVID vaccine. And we wanted to monitor their welfare. We published this, we looked at them, we used the AWAG to ensure that they were okay and had good welfare, which they did. And then Rachel came and started her PhD with me, developing the cloud-based software for monitoring the dog welfare, which is now used at various rescue centres and for working dogs. The IT support for this work has been provided by a company called Ruben Digital, with whom we've now developed this company, Welfare Assessment Technologies, to take all this forward. We've adapted it. I then spent a lot of time adapting it for use in zoos. There's a separate zoo website. And also for lots of other uses. It's used with lots of different types of animals and different uses of animals. And we assess these 4 parameters of physical, psychological, environment, and procedure. And each parameter has several factors, which I'll talk about a bit more in a moment. And each one is scored on a scale from 1 to 10. 1 is good welfare, 10 is bad welfare. Now, you may say to me, why 1 to 10? Surely 1 to 5 is good enough. And actually, when we started the Animal Welfare Assessment Grid, we did start doing 1 to 5. But we found out 1, of course, is the best welfare. And you can always do it better, can't you? So you'd score it a 2. 5 would be the worst welfare, and you'd never admit you were doing it the worst possible way. So you'd score a 4. So eventually, we'd narrowed it down to 2, 3, and 4. And there was very little incentive for people to change it and make it better to the next score up. So we then expanded the scores to 1 to 10, and we found that made such a difference with staff, particularly in the zoos, where if it scored a sort of 5 or a 6, oh, we can do this better and make it a 3 or a 4. And they were really motivated to improve the welfare and improve the score to make it good welfare. So the parameter scores are plotted on a grid, and the area of the grid is the cumulative welfare assessment score for that moment in time. So this is the basic welfare assessment grid. You can see the 4 parameters there and the scores of 1 to 10 going up. The bigger the score, the worse the welfare, the bigger the grid, the bigger that area that's coloured in, the worse the animal's welfare. So we look at the animal's physical condition, we look at the behavioural deviations to reflect its psychological well-being, the quality of the environment reflecting contingent suffering due to poor husbandry and not having good environmental enrichment and opportunities of space and such like, and looking at procedural and clinical events reflecting direct suffering due to concurrent illness or procedure. We're carrying out procedural events like transportation and that sort of thing. So here's some examples of what we see on the screen. So the AWAG illustrates the temporal moment. It measures the area of that grid, the cumulative welfare assessment score, and plots it against time. Now, I must stress for showing this, this is a completely made up example. This is not a real example. I have never seen an animal score 200, which would be the maximum score possible with the area of the grid. So you can see here, made up example, we've got an animal scoring about 50 or so, which is within normal limits, and then it gets worse and there's a problem, and then you can see it getting worse. We've also got detail on here about the animal, its owner, its name, what sort of dog it is, any conditions that it also has, and all the details we want. So we can then scroll down and look at the grids for individual moments in time. So you can see here we've got some grids, and we can look at what we've scored and what the scores were. Here's this score of 10 all the way through, which I've taken the grid out because it would cover the whole thing. And as I say, it's a made up example. The scores are color coded. So red is you do something about it, there's a problem. And then we go down through orange and down into green, and 1 is good. So that's looking fine. Now you can see here with this grid for the 29th of September, we haven't got anything on the procedural axis. This grid isn't missing one. And if you look at the data here, that's here, we've got NA not applicable. If for some reason you don't score one of the factors that we have in the scoring system, you just click not applicable, so it doesn't impact on the total scores. And then if you're scoring things and you're wondering, what's going on, what's happened, there are information buttons here, and you can click on those, and then you can look down and you can see where you put in notes. So for example, if you did score very highly, you can put in lots and lots and lots and lots of notes to explain what's going on. So if there's a flood or there's some disaster, you can write it in there. So you can explain what's happening, and to look back and sort it out. Now, how often do you score is the next question. If you've got animals that you're not doing anything different to, and it's day after day after day after day, the problem is everybody's busy. We haven't got time to do these things every day. And particularly if you're working, this is from Marwell Zoo, this example. What we did there was we scored some animals. You can see their score is roughly speaking around 10, which, when the maximum is 200. And we've shown with the, which Rachel may talk about in a moment, the sort of basic line for a dog is up to about 15 is within normal limits, because obviously even if you're scoring 1 or 2 for each thing, you're getting an area on that grid. So If you score these group of animals where nothing in particular is happening, they're in the same environment, they're quite happy, they're eating, they're drinking, you can see it going up and down every day. So then we took it out and made it every second day, every third day, and weekly gives us the same sort of pattern. So you can see the pattern for the welfare that's going on. Obviously, if something happens differently, you've got an animal that's clinically ill, you've changed the environment, you've carried out a procedure, you would measure it on that day and you would see the peaks and troughs as things go on. So what should we score? Well, the first thing to think about with dogs, environment really matters. Here is a video of two dogs having a happy time. They're Labradors. They love water. They love to go for a walk down by the river and go for a play in the water. That's what these dogs like. Admittedly, it depends on the breed. I haven't shown the video. What a video of a Jack Russell who's going, woof, woof, woof. I don't want to go in the water and get wet. But that's what matters to dogs. The environment matters. And yet this cartoon shows the other way of looking at it. What now? We've stopped. The park's just there. I've been so good. This isn't fair. So often people just take their dog on the lead. Yes, you put it on the lead when you're going on the road, when you're going in groups of people around and you want it to walk close to you, but let it have a run around from time to time and have some fun. Don't just keep the poor dog on the lead all the time. It wants a good environment. So thinking about quality of life, the animal's perception of its welfare isn't affected by the reason for its life or the cause of its suffering. They don't sign consent forms for what we do to them. So is it acceptable for animals to suffer? For various reasons. So, for example, for scientific progress, because we're using them in research, for owner ignorance, because they don't know and they don't know any better, to produce cheap food for farmed animals, for entertainment, racehorses, for example, or greyhounds, or to undergo major surgery. If they're going to go through that, do they sign a consent form? Do they want major surgery? And if so, if any of these we say, yes, we can do it, how much suffering and for how long? And that's what ethical review is about. That's what regulation is about and the legislation about animal welfare. But the success of all of those depends on the culture of the institution where you are, the resources of the regulatory authority, which I don't know about in the US, but certainly here aren't very great, society's values. What do we do? What do we need to do? What is the right thing? And often it also comes down to economics. Money, money, money. So whatever animals used by society, is it fit for purpose and is the total level of suffering justified by the benefits that come from whatever we're doing with this animal, whether it's an agricultural animal producing food, a racehorse causing lots of fun and aren't we having a great time? Is the horse having a great time? Farming, for example, those chickens, not good welfare, the zoo, or a pet dog that's running around and having fun. We need an objective measurement to justify reduced quality of life and decide what treatment is the most appropriate. So in general practice, as vet in general practice, it's not just about health and disease. There is much more to welfare than just health and disease. So thinking about companion animals, thinking about brachycephalic dogs, for example, what's the quality of life as that population gets older? There are so many of them with obstructive airway syndrome, lameness, and we need an objective measure to see how that is impacting on the animal. So the AWAG, I'm hoping, will become a routine tool in practice to look at this temporal component of suffering, giving us this visual illustration of quality of life, so we can make decisions about training the animal, the environment we're keeping it in, what treatment we're going to do, any surgical interventions. Because as a vet, my constant endeavour is to ensure the health and welfare of animals committed to my care. That's the oath you take when you become a vet. Animals don't give informed consent. It provides owner support with making those decisions. Euthanasia is something that we are very privileged to be able to do, but you need to support owners. And you also need to support vets and have an evidence base as to why you need to do it, because there are a lot of mental health issues in the veterinary profession. And some of them think that euthanasia means you've failed and you've done the wrong thing because you didn't make it better. We can prevent suffering. We are all of us, all animals, all humans, we're all going to die. It's one thing we have in common. It also helps public perception and education about animal welfare. But the outcome of measurement, of course, should be action to improve welfare. So thinking about pet insurance, pet health insurance, is this a carte blanche to just do more? Social media has a huge influence, and just because we can, should we? Think about some of the orthopedic interventions that we do and setting up of hospices for dogs. does this mean, with the concept of one medicine, that we should treat all animals like humans? Here is an example of a dog some years ago, a dog that was the RSPCA were called to it. It was 14 years old and had such matted fur around its feet that the blood supply to its front paws was so bad that it lost both front paws at the age of 14 when they rescued this dog from the owners who were incompetent and put it on this frame. And now they have to find a new home for it. Is that really what the dog wants? Is that really the best thing for that dog at the age of 14 to go through all of that? That's something we can debate and we can discuss. So the AWAG cites so far and for the future, we've defined the factors and the scores relevant to different species and different types of use. Ruben Digital doing the website development and working with us with welfare assessment technologies. Rachel's PhD was funded by Agria and the Swedish Kennel Club. The dog AWAG is used for working dogs, guide dogs, for example. A lot of zoos are using it. We use it for primates, for vaccine studies, and we've also started working with St George's University and Sussex University, using it for genetically modified rodents. Greyhound Board for Great Britain use it to monitor the welfare of their greyhounds. We've done some pilot studies with retired racehorses. And we're about to start a new study with racehorses. And we've done some pilot studies with farm cattle and pigs. And we want to link with telemetric monitoring as these technologies are developed. This is a picture of my dog, my very own dog. That's Bracken, my Labrador. And you can see on his collar, he's got a little techie thing on his collar. And what that does is it measures his activity, his sleep, his heart rate, and his respiration rate, and gives you a lot of information. And what I want to do is to be able to link that information into the AWAG as time goes on, as we develop it. We found that the AWAG, when we're talking to staff in the zoos and on farms, it really encourages teamwork and discussion about welfare. They communicate, but suddenly they're thinking about welfare and want to improve it, and they take action, and we get better animal welfare. So the current factors for dogs for each of these parameters, there's some examples here. I think probably Rachel's going to talk about these a bit more as well. But these are the default factors for the dog AWAG of what we're actually scoring. There are other factors available because you have to tailor the factors to the type of dog use that you have, what you're doing with this dog, whether it's a working dog, a pet dog, particular type of dog, and things that you're doing with it. And of course, there are more that we can develop. So an example of in each of these factors, the scores are defined. So for example, body condition score is something we score regularly for animals, and it's scored between 1 and 5. So we have to translate that between 1 and 5 score for body condition score into 1 to 10 for the AWAC score. And when you click on the software, you go down and it will give you the definitions for the scores. And if you're using something like the body condition score, it translates it to 1 to 10, so you can see how to do it. And everything is defined, so that's very little inter-observer variability. There is no one size fits all, so the AWAG profile have to be configured to the specific animal, specific species and the type of use. And then we set up the factors to score, define the score. There will be phrases in the scores, and you can click on it to get a definition if you don't understand what it's talking about. So for example, if it says if the animal has the ability to choose where to sleep, rest, and visualize the environment from different vantage points, which is some of the environmental scores, you can click on choices and it explains what it means. You can select a score bias if necessary and define that if there's something that's really, really important. You can pre-fill it with previous scores. So for environment, if nothing's changing, it's the same all the time, it will pre-fill, and then you can adjust it as necessary. And you can put in all the general information about its health condition, housing, and type of animal. So the outcome of using the AWAG is that it will link to new technologies, generate big data on animal welfare, informing policymakers, helping develop legislation and drive improved attitudes and investment, giving you this visual representation which is easy to understand and encourages communication and thinking about welfare and helps make decisions about treatment, because you can score it prospectively. If we do this to your animal, this is what it's going to score. It enables drilling down to those separate components of welfare, allowing objective feedback on all the changes affecting welfare, and then your ongoing refinements can be targeted at those specific elements to improve or prevent the deterioration of the animal's quality of life. So you can plan, intervene in a targeted and timely way, communicate with the team, think about it, how are you going to improve the animal's quality of life. And the important thing is take action and show the impact of your action. So we have a good life, or a life worth living, for the animals and also for us, for all of us. There's the background references, which are available on the website, which we published. And I hand over now to Rachel, who's going to talk to you about using it.
Thank you, Sarah. Hi, everybody. Thank you for joining. My name is Rachel Malkani, and I'm going to be talking about how I developed the AWAG tool for dogs and discuss more in depth one of the studies we have undertaken using the AWAG. So my PhD research involved setting up the online platform for the AWAG to be hosted, also developing the tool for dogs and undertaking validation and reliability testing of the tool, and then also obtaining scores for dogs to undertake some analysis of that data. So in order to start developing the tool for dogs, the factors across each of those 4 parameters that Sarah mentioned, physical health, psychological health, the environment, and any management or procedures that we undertake, these needed to be established. So in order to do that, I first undertook a narrative review of the literature related to quality of life in dogs. And I created quite a huge list of factors that might be important to dogs, and then went through and removed any factors that really wouldn't be feasible to score, such as abnormal behaviour or stereotypies. And from there, written descriptors from each score were written. And as Sarah mentioned, these are on a score point from 1 to 10, 1 for best welfare possible and 10 for worst welfare possible. These were all defined and put onto the AWAG platform, and these were trialled with 12 veterinary and animal welfare professionals. So feedback from that led to simplifying the language of the tool to make it easier for people to use, and also removing factors that they felt were redundant, such as comorbidities and travel. And that reduced the list from 22 to 16 factors, and this made the tool more efficient in practice. And since then, we've now further refined the tool, and the factors that are under the physical parameter that Sarah kind of had up on the screen there are body condition, clinical assessment, eating and drinking, mobility and activity, and sleep over a 24-hour period. And as Sarah mentioned, when you click on the eye icon, all of these factors are defined from 1 to 10 to make these as objective, and these are mutually exclusive from each other. The psychological factors that we assess are aggression towards people, fear, anxieties, and frustrations frequency, and how long a dog takes to recover from a stressor. The environmental factors that we assess are choice, control, and predictability within a dog's life. Enrichment, and this is defined as an addition to the environment that enhances the dog's mental state. And also we assess the dog's social interactions and how the environment facilitates this. And finally, on the procedural parameter, we assess anything that management events, any procedures that may impact the dog's welfare. And these can be the dog's behaviour during the assessment, the change in daily routine, handling during the assessment, and procedure pain. And if there was no procedure being undertaken, as Sarah mentioned, we would just skip that and answer the ones that were applicable. Even undertaking the AWAG assessment can be a stressor in itself, so we'll always be assessing the behaviour during assessment. So we needed to establish that the AWAG tool was reliable and that it was valid, that it would assess what we wanted to assess, that people undertaking it would obtain the same scores from somebody else. So we really needed to kind of look in depth into this tool and take tests to see that it was a robust objective tool. So in order to establish content validity, 7 subject matter experts reviewed the factors. And these subject matter experts consisted of European veterinary specialists in behavioural medicine and animal welfare scientists, and veterinary professionals, and they independently rated the factor's relevance on a 4-point scale. So each factor was scored either 1, not relevant, 2, somewhat relevant, 3, quite relevant, and 4, very relevant. For each item, the item level, content level, validity index, this equals the proportion of experts giving a rating of 3 or 4. A score above 0.78 is considered acceptable in the literature, and the score we achieved was 0.99. The scale level content validity index is the average of all of the item CVIs across the whole tool, giving an overall measurement of agreement. And this score, again, the acceptable level is 0.78, and we obtained a score of 0.94. So this shows kind of near unanimous expert agreement that the chosen factors were relevant to assessing dog welfare. So we also wanted to assess construct validity. So construct validity tests whether any tool can distinguish between different states. So with the AWAG, we want to be able to distinguish between different welfare states. So to do this, we scored 3 groups of dogs using the AWAG. And the first group was dogs that were medically and emotionally healthy, as assessed by a vet. Healthy dogs that were undergoing neutering. So this is a short-term welfare challenge. And then a group of dogs that we know have chronic disease. And this group we know is likely to have poorer welfare due to the impact that chronic disease and illness has on quality of life. So with this data, we examined the CWAS scores, the Cumulative Welfare Assessment Score, using Mann-Whitney U tests. And these results showed significant differences between healthy and sick dogs and between healthy and post-surgical dogs. And this confirmed that we had good construct validity and that higher welfare scores corresponded with poorer welfare. So after confirming that the AWAG could differentiate between healthy and sick dogs, the next step was to test how consistently the tool performs over time and between different users. We tested if different people using the AWAG give the same score for the same dog at the same time. Pairs of veterinary professionals, vets and veterinary students, scored dogs simultaneously during consultations or hospitalisation without discussing the AWAG scores. The statistical analysis showed a high level of agreement with an R value of 0.97. And this score suggests that the AWAG's mutually exclusive scoring descriptors minimise subjectivity because each welfare factor is clearly defined from 1 to 10. We also assessed if individual clinicians scored the same healthy dog multiple times over stable conditions over a 2-week period. And the results again showed a high agreement with a score of 0.89, and this demonstrates good test-retest reliability. So what do these good validity and reliability tests actually mean in practice? They show that the AWAG for a dog isn't just a theoretical measure. It works as a valid and reliable tool. It can consistently differentiate between healthy and unhealthy welfare states, and it produces stable scores regardless of who's using it or when it's used. And that level of consistency is really essential in a tool because welfare assessment needs to be more than just our subjective perception and judgment. So I know Sarah said this, showed this output earlier, but I really love the visualizations that the AWAG shows because we've got these visualizations so we can easily see changes in welfare state over time. And here we can see the output of the Cumulative Welfare Assessment Score. And this here is my dog. So I'm going to use the laser pointer. So here we can see in June, this is not long after I first got Indy, and her score, pretty much as soon as we get her, she had to get her vaccination. So it's quite high here. So I'm just going to backtrack a little bit. I want to show you this. So there's a grey area here. This is the range of the average healthy dog. So we scored a cohort of healthy dogs, as I mentioned before. There's hundreds of dogs, and we took the mean scores of these dogs to be able to show how dogs, their score is compared to the average healthy dog. So this thicker dotted line here is the average healthy dog score, which is 5.8. The lower score here is the minimum range for the average healthy dog, emotionally and medically. And here is the upper range. So if your dog falls within this grey area, we can say that your dog falls within the range of the average healthy dog. And any kind of deviations above this, we kind of would want to get concerned here and say why, what can we do to improve the welfare for this dog. So we can see Indy's score here is higher than the average healthy dog. She'd just arrived. She was living with a foster family. Previously to that, she was living up north. She spent most of her time in a crate. So when she arrived with us, she was pretty scared of life, really scared of other people, tolerated other dogs. And then, as you can see, over kind of going months, we kind of worked with her, and our score, there probably should have been more assessments, but her score gradually kind of went down into the lower range of what the average healthy dog is. Unfortunately here, I was on my way to a veterinary conference in England, and my dog was staying with my mum. And no idea what motivated her to jump over a fence, but she jumped over the fence and unfortunately fractured her leg really badly, and also dislocated another joint as well. So they wanted to do a whole kind of big ortho referral, and she probably needed multiple surgeries, external fixator. Surgeries could fail, so I really didn't want her to have to go through that. What would be nice if I actually had the other scores here to show you. However, I did a prospective score of Indy. And if we were to go down the ortho route and get multiple surgeries, long recovery times, she would have had a really high score, probably between about 60 and 100 for a prolonged period of time. And that's just something we didn't want to put her through. And this will vary from every dog. One dog might be able to tolerate this a lot better, but I know Indy, she wants to be out. She does not want to rest, have some cage rest for a long time. So amputating her limb was the best thing to do for her, because as we can see, within months her welfare shot down again to the normal range, and she was, within a few weeks she was running about again, and she does absolutely fantastic on 3 legs. So also here we can see the individual parameters, and this is the average of the individual parameters, and we can see what is most impacting welfare. So here we can see that it isn't actually Indy's physical health that's most affecting her welfare. It's her environment, and also well, the procedure that was undertaken, and her psychological health is actually kind of a lot better here as well. And we can also further drill down and see which individual factors are causing the high scores, and this allows us to make targeted improvements. So here we really needed to improve Indy's environmental health. So what was happening here was she really wasn't getting those social interactions, that social environment that she so needs, and that enrichment, engagement, playing, she really wasn't getting that while she was resting. So that's why her environmental factor was really affecting her health. So I'd now like to talk about a study that we undertook using the AWAG to find out if we can identify specific factors that can predict behavioural problems in dogs. So the study aims were to identify which individual factors are significantly different between dogs that have been referred for behaviour disorders and these scores compared to healthy dogs. We wanted to explore correlations between different factors in dogs with behaviour disorders. And then we also wanted to determine which factors are predictive of behaviour disorders. So in this study, veterinary surgeons, nurses, behaviourists, and animal welfare professionals were recruited to use the online AWAG platform. Participants completed AWAG assessments for 129 dogs with behaviour disorders, and this generated 177 assessments in total between 2021 and 2023. And we also used a comparison of 117 healthy dogs, which were previously scored in earlier AWAG validation studies that I mentioned before. So when using the AWAG, all users received standardized training videos on using the AWAG to ensure consistency. And the owners that were companion dogs in the studies signed consent forms, or if it was shelter dogs or working dogs, the shelter managers or whoever was the caregiver of that dog provided consent. And the dogs with behavioural disorders were also grouped into categories such as anxiety disorders, phobias, separation-related behaviours, or abnormal repetitive behaviours. So following data collection, we examined the cumulative welfare assessment scores between healthy dogs and dogs with behavioural disorders. The mean score of healthy dogs was 4.94, and the scores ranged from 2.25 to 15. And the mean score with dogs for behaviour disorders was 27.9, with a range of scores from 2.92 to 101.75. And with the healthy dogs, we can really see that all these scores are clustered around here. They're really condensed. They're quite low. Whereas in dogs with behaviour disorders, these are much more narrow and they're much more varied as well. And we can see there's quite a few high outliers. And that kind of really mirrors the spectrum of behaviour disorders that we see in dogs. Some can be quite mild and maybe not really impacting the dog's welfare, whereas others are much higher and much more severe and really impacting dog quality of life. So we also used Wilcoxon rank sum tests to compare factor scores between healthy dogs and those with behavioural disorders. And every factor, besides body condition score and procedure pain, were significantly different between healthy dogs and dogs with chronic behaviour disorders. So this suggests that dogs with behavioural disorders consistently show poorer welfare across almost every domain of the AWAG. Higher scores in clinical assessment and mobility may reflect chronic pain or medical issues that contribute to behavioural change. Elevated scores in fears, anxieties, and frustrations, and fears and anxieties and response to stressors indicate a skew towards negative and protective emotional states. And also poorer scores in environmental factors such as enrichment, social interactions, and choice and control suggest that dogs that live in unpredictable or unstimulating environments can compound negative emotional states. And these results really highlight the multifactorial element of behavioural disorders and how they are so intrinsically linked to physical health, the environment, and how we manage dogs. So I just wanted to again show the variation in scores of healthy dogs and behavioural disorders. As you can see, the healthy dogs are clustered around the lower scores here. And I think this slide really shows how we've got a lot of variation, but for some factors, the scores are more clustered around kind of the higher scores, and the dogs with behavioural disorders have that wide variation, especially in the psychological factors, and the scores are skewed towards the higher end in how when we're actually undertaking the assessment, we can see we've maybe got quite a wide range in the behaviour during assessment. Dogs with poor choice control and predictability, that's probably more skewed to the poorer scores. Enrichment, the reaction to stressors, so how long does it take the dog to recover from a stressor is much higher in these dogs, and also their social interactions are poorer as well. So we also looked at correlations using Spearman's rank correlation to examine the relationships between factors. So this correlation matrix here revealed several strong relationships, and change in daily routine and aggression towards unfamiliar people showed a strong and significant correlation. We also found behaviour during the assessment and fears and anxieties frequency was strongly correlated. Change in daily routine and procedure pain. Change in daily routine and eating and drinking. And clinical assessment and procedure pain was strongly correlated. So these strong relationships reinforce that these factors are not independent from one another. There's a complex interplay, and where one factor changes in one area can have an impact on another area of dogs' welfare. The strong relationship between change in daily routine and aggression towards unfamiliar people may suggest that instability or unpredictability in a dog's environment may heighten anxiety and reactivity. When a dog's routine is inconsistent, it can lead to loss of control and predictability, and these are key components of emotional security. And similarly, the association between behaviour during the assessment and fears, anxieties, and frustrations frequency may suggest that anxious dogs often struggle more in unfamiliar or clinical settings. Struggling to cope during handling or examination is likely indicative of underlying emotional distress. So overall, these relationships illustrate that behavioural disorders are part of a broader welfare picture, where physical health, emotional stability, and environmental richness and predictability are all interlinked. So finally, in this paper, we ran some logistic regression models, and these were built to assess which factors may be predictive of chronic behavioural disorders. The logistic regression model revealed that clinical assessment, aggression towards caregiver, and choice control and predictability, and finally fears, anxieties, and frustrations frequency were predictive of chronic behaviour disorders. So first of all, clinical assessment being predictive of behaviour disorders just builds to the existing literature that we do have a lot of evidence that poor physical health and underlying medical issues are more likely to present with behavioural disorders. And again, this provides more evidence to show that there's a strong link between physical and emotional welfare. Pain and illness and discomfort can directly influence behaviour. Aggression towards caregivers was one of the strongest predictors. And this suggests that emotional attachments are associated with poor welfare. Chronic stress, breakdown of trust, or aversive training can erode the human-dog relationship, causing negative emotional states and poor welfare. Choice control and predictability was another key factor that was found to be significantly predictive of behavioural disorders. Dogs living in environments where they have little to no control over what happens to them, for example, unpredictable routines, restricted autonomy, or inconsistent responses from humans, are likely to have poor welfare. And that lack of predictability can be a trigger for anxiety and frustration in dogs. And finally, fears and anxieties frequency was also highly predictive of behavioural disorders. And this reflects the understanding that chronic anxiety is both a cause and a result of poor welfare. Dogs frequently exposed to stressors or lacking coping mechanisms are more prone to developing behaviour disorders. And these states often persist unless their environment or management changes. So altogether, these predictors further reflect that behavioural disorders are not isolated problems of training or just temperament. They're indicators of compromised welfare influenced by health, emotional state, cognition, and the ability to make choices within their environment. From a practical perspective, these results show how the AWAG can help identify dogs at risk early. And by monitoring these key factors, we may be able to intervene early and promote better welfare in dogs. So I'd like to acknowledge some limitations of this study. The classifications of behavioural disorders relied on the clinical and professional diagnoses rather than a standardised diagnostic framework. Therefore, there is likely some variation in how cases were defined across users. Another limitation is that the data were mostly cross-sectional, capturing welfare at a single point in time, as many dogs only had single assessments rather than multiple. And due to not having a large data set, we also didn't examine the different subtypes of behavioural disorders due to insufficient sample sizes. So once we've got a much larger data set, we'll be able to look at these analysis again for different subtypes of behavioural disorders. So this study provides various directions for future research. As I mentioned, having a longitudinal approach would be really valuable in our new data set. Following dogs over time would allow researchers to determine whether changes in welfare scores actually predict the onset and improvement of behavioural disorders, and this will help us to indicate a cause and effect relationship. Incorporating physiological indicators such as cortisol levels, heart rate variability, or activity data, as Sarah mentioned, using the wearable monitors, can make the assessments more objective and comprehensive. And also it'd be great to expand the validation studies across different countries, breeds, contexts, and this would help that the tool performs consistently in different areas and just adds another layer to that validation and reliability testing. So in future work, we'd also like to test how specific welfare interventions like enrichment programs, medical treatments for pain, for example, or behaviour modification plans influence welfare scores before and after implementation. And as I mentioned, it would be really useful to analyse behavioural subtypes separately. For example, it'd be great to have anxiety-based disorders and if these have different welfare predictors or kind of compulsive disorders. Yeah, and as Sarah mentioned, integrating the kind of welfare monitoring technology could make welfare assessment more continuous as well and less dependent on human observations. So all these directions can really advance the AWAG from a research tool to a kind of fully integrated clinical welfare monitoring system. And we also are working on separate studies on sleep at the moment using the wearable trackers. So hopefully these will be published in the near future. So thank you very much for listening. And yeah, we welcome any questions.
Wonderful. Thank you so much, Drs. Malkani and Wolfensohn. I first became interested in your tool, I think probably about 2 years or so ago when I was looking to do a research project looking at welfare, and I'm just so excited to see what you've accomplished thus far, and this presentation was just fascinating in terms of lots of questions and ideas, so thank you. And let's jump into some questions. So the first question is, has this tool been implemented in animal shelters or rescue centers?
Yes, so yeah, the tool, we have various animal welfare shelters using the tool. We have many assessments that have been undertaken from RSPCA in New South Wales, and I think it's Victoria, the other shelter there. Apologies, my knowledge of Australia geography isn't that great, but yeah, they undertake scores widely. They don't just use it within the shelters, they use it for their inspectorate as well. So going out to kind of assess the welfare of animals that they've been called out to. They've used it in kind of prosecution cases, and they also use it in looking at the welfare of dogs that have gone into foster and monitoring dogs once they've been adopted as well to see if that they are in a suitable environment post-adoption and if they're coping well.
Okay, thank you. And so related to implementation in that setting, have there been any issues with implementation, such as like staff not having time to fill out the assessment or training that's required?
Not really. We've had really good feedback. Also, we've had another study that's been under review for a while that hopefully will be published soon, and it does detail how the tool facilitates discussion. It's largely a qualitative piece and shows how it's really improved the ways of working, especially in the shelter environment. It facilitates discussions among different colleagues from animal care assistants and veterinary nurses, techs, and vets, and anyone working in the environment to discuss that dog's quality of life and how they can improve it and where they might be going wrong. And it doesn't matter which person is assessing the dog, because they can pick up the next day. If it's someone else, they'll be able to see the scores, and it really helps people be more involved and really understand what's been happening with that dog. If it was the first time seeing a particular dog, well, they can go onto their iPad, look at all the scores, and they understand really what's been going on with that dog over time.
Okay, thank you. And just following up related to training, how much training is required for people to be able to use the tool?
You watch a short video there's 2 short videos, I think, maybe about 10 or 20 minutes each. Sorry, it's been a very long time since I've watched them, and I don't think we've had anyone come back and say, oh, I've got a question about this, I wasn't sure how to do this. It's really intuitive once you get logged on. And so once you first start using the tool, people report, probably takes about 10 minutes to put in the dog's details and undertake an assessment, get used to the tool. However, once you're familiar with it and you know the factors and it's kind of in the back of your head, okay, I'm going to be scoring this, this, and this. I know what to look for, or if it's in a consultation with the owner, I know what to ask. Most people say it takes less than 5 minutes once you're more involved with the tool.
Wonderful. Thank you. That was going to be my next question, so you answered it. Thank you. All right. Next question. Thank you so much for this presentation. I have 2 questions. The first one is, are there plans to create an AWAG scoring system for cats?
We do have one for cats. We have just undertaken a project with the University of Edinburgh, getting that set up. So yeah, it's now available. It has undergone what's the word just coming? I'm just talking about it. Validation is the word I'm looking for, validation testing. We haven't undertaken any reliability tests yet. So if anybody would be interested in getting involved with that, yeah, please email us and let us know. But the cat tool is pretty much ready to go.
Of course, we've used it in zoos with tigers and published that, but domestic cats is going to be rather different. So, yeah.
All right, thank you. And next question is this tool available for public use? It sounds like it is. How do people register to start using the tool?
That's something which we're sort of working on at the moment, because at the moment you have to go to Welfare Assessment Technologies, and the staff there then have to talk and think about how they're going to let you on and register and such like. And Rachel has been doing this herself, but of course hasn't got time to do all that all the time. So what we want to do is to have a system where you can register for it online, and that's what we're working with the computing people at the moment to get that developed and set up. But at the moment, if you email us there, then Jill, who is the admin person who deals with it, will sort it out. But it just takes a little bit of time because we're trying to get it automatic so you can log in and register.
Yeah, it would be really nice to have it automated so people can just create their own login details, pay, and then they have use automatically rather than having to wait for us to email them, set up log details and everything.
And do you have any kind of rough estimation for when it's going to be more easily accessible?
I would hope that early in the new year. We've started working on it and discussing it, but the chief executive, he does some work abroad, and he was abroad for a month, so I talked to him for the whole of November. He was away, so I'm hoping we will get this sorted out shortly after Christmas, I hope.
Okay, so hopefully early 2026. Awesome.
Yeah.
And so the second question from that 2-part question, it sounds like you don't have the answer to, but I'll ask it just to make sure. They ask, what is the cost of using the AWAG?
This isn't a definitive answer because we're still discussing, and then you have to think when we set it up what it's going to cost. But what we're looking at the moment would be £10 a month, so £120 a year. So it's a £10 month subscription.
Okay, thank you so much. All right.
But that may vary. Don't quote me on that exactly, because obviously until we actually get it going and see what it's costing us. Yeah.
Yes, but I think it's good for people to know generally a range. Thank you. All right, the next question is, was body condition score too high or too low in the behavior disorder dogs?
By that question, do you mean overweight or underweight?
Yes.
Yes, because in this low would just, yes. So just to clarify the scoring, a good score, like 1 and 2, the lower scores would be perfect weight, but as they get poorer, they would be overweight or underweight, if that makes sense, going higher. However, looking at the scores independently, the majority of dogs who had poorer scores were underweight. Sorry, were overweight, but some were underweight also. But the majority of dogs with behavioural disorders with poor body condition scores were overweight compared to underweight. Does that make sense?
Yes, that does make sense and it answers the question. Thank you. All right, next question is, can you speak to the benefit of listing procedural elements separately rather than within the other items like physical or psychological factors? So why is procedural separate?
Do you want to do that one, Sarah?
We set that up separately because so often you do something to an animal, and it tends to be that you sort of ignore the impact on the animal's physical condition or the environment, and yet it does impact on all of those. And the four parameters do overlap in the impact on the animal, there's no doubt about that. But looking specifically at procedures, because the animal's living there, it's quite happy doing all sorts of things, eating, drinking, running around, doing whatever, and then you go in and do something to it. And that's what you want to look at and say, why can we do this better? Can we train the animal? Can we get it to accept being handled and picked up? And I mean, we need to think about our interactions with the animals with doing procedures rather than just, oh, I'm going to do this. I will catch it and I will put a tape around its nose or whatever. Well, no, you don't have to do it that way. Train the animal.
Yeah. And for example, looking at from a more kind of medical perspective, when I was looking at dogs with cancer and examining their scores, before scoring, a lot of people would just talk about the impact of the cancer on the dog rather than the impact of the treatment itself. So if we weren't looking at those procedural scores, we're not looking at the side effects of the drugs that they're getting. We're not looking at the impact of having to go into hospital for treatment, the side effects of treatment, actually how that's impacting the animal. And a lot of the time, the treatment is affecting quality of life. It's having a greater impact than the actual disorder, than the cancer itself. So by monitoring that procedure factor, we're really getting a more comprehensive picture of quality of life, just being kind of narrow focused on the disease itself.
Thank you so much. I really, really appreciate that response. Next question, are there any thoughts about developing an app for the tool?
Sarah? I think it would be cool. It would
Yes.
be awesome if we could, yeah.
Lots of thoughts about it. It's a question of getting the IT people. I mean, there's no way I could do that. My IT knowledge and skills are not in that league at all. So it depends on getting the IT people to do it. And that's going to have a cost associated with it.
Yeah, and it is formatted for the usage on phone. You just have to type in the website and use it on your phone, and iPad and tablet and PC, and whatever format you want to use it on. We do have people using it on their phone, but we don't have a dedicated app as yet.
Yeah, when we did the pilot study with the horses, it was just great because all the sort of kids that looking after the horses just had it on their phones and were going around and filling it all in, and it was very easy for them to learn to use it and do it. But yes, having an actual dedicated app for doing it would be brilliant, and I would love to do that. So if there's anyone out there who's a computing person who knows how to do that, then let's get on with it.
Wonderful. All right, next question, and we're just about out of time, but I do want to ask this one, is does the tool ask about things? I know it assesses the impact of medical conditions and behavior conditions, but does it ask about what specific medical conditions or behavior conditions that an individual animal has so that you can look at, because I know you talked about being able to look at impact of different conditions on scoring. So is there a place that asks that?
Yeah. So when you're registering the animal's details, it will ask you kind of more clinical details. If, for example, would in a drop-down bar, you'd select whether cancer and was it a pain disorder, osteoarthritis, behavioral disorders, you'd select anxiety disorder, and then that's saved on that dog's profile. So when you go to analyze all the data, you can then categorize it into whatever kind of chronic disorder you've got there.
Okay, thank you. And we're out of time, but we just had one last really interesting question come in. Can you guys stay on just a minute longer to answer that question?
Yeah.
All right, and this question is, how much adaptation is required to use this tool across different species?
we are using it across lots of different species. Obviously, there is no one size fits all. You have to tailor it to the species you're working on, because what you score for a rabbit is going to be very different to what you score for a dog, what you score for a horse, and horses in different uses. So what you score for a racehorse will be different to what you score for a kid's Shetland pony. It's used in a riding school. But we've used it for lots of different animals, particularly in zoos. We've used it for insects, we used as well, which was fascinating when we looked at that, to know about the behavior of insects, which also validated it for using it for groups of animals rather than individuals, because quite often with some species you're keeping them in groups and you can't identify separate individuals. So we assess the welfare of groups. We also used it for decapods and cephalopods as well, so invertebrates. So we've already used it across a wide range of species, and a lot of the papers, they're on the website, you can see those.
All right, wonderful. Thank you. Thank you so much, Drs. Wolfensohn and Malkani.
Thank you for having us.
Thank you.
Our speakers will be available for the next few days on Maddie's platform to continue the discussion and answer your questions. Thank you all, and we will see you next time. Take care.